Health Authority. The purpose of this statement, therefore, Honorable Speaker, is to request the honorable members to support Social Health Authority rollout in their respective constituencies and counties for the county women by linking up with the officers listed in the respective regions and counties and contracts provided. In conclusion, Honorable Speaker, the registration of Kenyans, if implemented by the Ministry of Health in the manner that the latter explained to the committee, would contribute significantly to the digitization and modernization of Kenya's healthcare system, ensuring accessible, affordable, and high-quality care for all Kenyans as envisioned in the Kenya Health Policy 2014-2030 and the Kenya Universal Health Coverage Policy 2020 to 2030. Honorable Speaker, the challenge that many Kenyans face is because they want to register at the time when they are getting services. But we are requesting many Kenyans that they should register early enough so that when you go to get services in the hospital, you're already a registered member. You should not be struggling to register. And as per yesterday, we agreed with the Social Health Authority that they should contract all level 4s for outpatient services so that primary health care can be offered at level 2, level 3, and level 4. So that all level 4 facilities should be able to provide primary health care and people can walk in and walk out and get the services in which they are going to be provided. And the method for payment will be through capitation. And we want to ask Kenyans for patience so that, and also timely registration so that they can be able to access services without any difficulties. Thank you, Honorable Speaker, and I want to table this and ask members that they can go to the table office, look at their constituencies, and get in contact and get in touch with the Digital Health Agency and the SHA Authority officers who are responsible for registration in your area so that people can be able to be registered. They can also assist us in identifying who are the indigents so that the indigents can benefit from government support through being registered and being having access to services. Thank you, Honorable Speaker.
Honorable Rindikiri.
I want to thank you, Mr. Speaker, for this opportunity. And I want to really appreciate the focus of our chairman of Health Committee. However, Mr. Speaker, there are some clarifications that the Kenyans need to be told. On the matter of registration, there are new registrations. The people have never been with the NHIF. And there are old card holders of NHIF. That matter needs to be clarified because what is happening now, particularly in the old card holders, they appear in hospital, the outpatient is working, the inpatient is not working, and vice versa. Mr. Speaker, what I thought the chairman could also come out very clear is to tell us exactly what are the causes of these delays. Is it a system failure? Is it a human-created failure? Or is it a natural law? Because it is very funny. The government is doing whatever it can. I believe there is something wrong at NHIF or SHA, whatever it is. Mr. Speaker, it's something that the committee need to investigate to find who is causing this delay. Because surely, when I use my ID and my old card number, I am not able to access. We have been blaming Kenyans for not having digital phones. But at my constituency level, Mr. Speaker, Bunge constituency, I assigned my staff to go around asking people who are not registered to register. But when you try to access that system, it is a nightmare, Mr. Speaker. So we need to know exactly what is the cause of this delay. Is it an intentional delay? Or is it a sabotage? What it is? Because this scheme is the best. But now if Kenyans are not able to access the services, we can't be sitting here every day.
Make your point. You've already asked a question.
Thank you, Mr. Speaker. It's a month gone. The numbers are not that big. And we must tell the Kenyans that people think that the government is not working. The government is working, but something is not right at the headquarters. Thank you, Mr. Speaker.
MP for Baringo South.
Thank you, Honorable Speaker, for this opportunity. I also want to register the challenges that is facing this exercise of registration, that there is a lot of confusions, and we don't know the source, or rather the cause. We want the ministry specifically and the officers of SHARE to be very clear on this, because people who are sick, as they go for those services, some of them have registered, but they are told there is no specific number, reference number, because the numbers they are using is the holding numbers of NHIF. So it's like there is somebody somehow in the systems who is not honest, because registration is doing well, and Kenyans have accepted, and the exercises of registration is all going on well. But the services, Kenyans want to see these services. Thank you, Honorable Speaker.
Honorable Badibadi, I see your name on the screen. Do you have an issue here, or it's an old one?
It was an old one. Thank you, Honorable Speaker, for giving me this opportunity. But I wanted to converse on the old one.
Okay, fair enough.
Yes.
Honorable Member, at the end there.
Thank you, Mr. Speaker, for this opportunity. I would want to ask the chair to clarify, Mr. Speaker, on the role of county health promoters on sensitization of sheep, Mr. Speaker. The last time I checked, Mr. Speaker, the remuneration of county health promoters was undertaken by both county government and national government, Mr. Speaker. Mr. Speaker, there is a lot of complaints at the mashinani level that people are not able to understand or to differentiate between chief and SHA. And they are not able to understand what chief stand for or what chief will undertake. I would want the chair to clarify the role of county health promoters on sensitization of chief, whether they are going around the country explaining to the people what chief means and what chief will do to them. Thank you, Mr. Speaker.
Sure. I think I take a very last one. We have other businesses to transact, and so you'll be the last one to ask a question.
Asante, Mheshimiwa Spika. Yangu ni ule utaratibu ambao unahitajika kwa wale ambao walikuwa wamejiandikisha katika ule mfumo uliopita wa NHIF na sasa na huu mfumo mpya. Tunafahamu kwamba hata sisi kama wabunge tulikuwa tumechukua majukumu kupitia mfumo wetu ule mfuko wa NGCDF kuandikisha baadhi ya wale ambao wanahitaji usaidizi. Na walioandikishwa wakati ule ilikuwa ni wale watu ambao hawajiwezi, ni wazee, ni wakongwe, ni mayatima, hawana namna yoyote. Na katika huu taratibu ulioko ni kwamba inabidi waweze kusafiri kwenda vituoni na kujisajilisha upya. Ilikuwa ni ombi kwa mwenyekiti wa kamati husika kama ataweza kufanya utaratibu wa kuwatembelea wale ambao hawajiwezi, hasa ambao ni ukweli ndio wanahitaji huu usaidizi, kuona ni vipi wataweza kuhamishwa, kwa sababu wengi wao bado wako katika ule mfumo wa zamani ambao kama wenzangu walivyotanguliza ni kwamba wakiwa na dharura na kwenda hospitali hawapati matibabu yoyote. Kuna utaratibu gani ambao anaweza kufanya wa dharura ili wale ambao hawezi kwenda kwa vile vituo waweze kusajiliwa ili waweze kunufaika na hili? Asante Mheshimiwa Spika.
Chair, please. Among the things you just been mentioned by, which you should take note of.
Thank you, Honorable Speaker.
For the benefit of the members.
Yes.
Some members, of course. and even the wider public.
Yes.
Explain also what's the difference between the chief and the sheriff.
Yes, I wanted to begin
One
from
manages
there.
the other, but you have to really bring it out. Yeah.
Honorable Speaker, the authority is called SHA, Social Health Authority.
That's the one
Social
which
Health
manages-
Authority
yes, manages.
manages three funds.
Yes.
The Social Health Insurance Fund,
Yes.
which covers for your health at level 4, 5, and 6. It also manages Primary Health Care Fund, which covers for your health in level 2, 3, and 4 outpatient. For 4 is outpatient services. And then it also manages Emergency, Critical, and Chronic Illness Fund. If you are using your Social Health Insurance Fund and you exhaust it, you have a chronic illness, you are diabetic, you have a renal disease, you're on dialysis,
You still get the services.
you still get services, but now the services will be, you will be utilizing a different fund because you've exhausted your Social Health Insurance Fund.
Okay.
So it is managing those three funds. The Honorable Wamumbi talked about county health promoters. It is not county health promoters, it's community health promoters. Community health promoters are at the primary health care level. This is a network that each community health promoter is in charge of 100 households. And in these households is able to at least identify the illnesses that these people are having. You can be able to make diagnosis of this is a diabetic, this is hypertensive, and refer you to the health facility so that you can get proper treatment. And the role of county governments in community health promoters is that they are the ones, the county governments are the ones who recruit them. They also co-share the payment, where the national government gives 50% and the county government gives 50%, so that these community health promoters at least have something to take care of themselves. Initially, they were not being given anything, but now they are given a small stipend of 5,000, and it is paid by both national government and county government. And then the national government also has a responsibility to train them, because you remember, I think this morning we've just passed a community health workers bill by Honorable Member for Ward Chief. That bill now will be able to provide for training, registration, and how these community health workers can be managed. My colleague Honorable Mugambi and Honorable Kamuren raised about the issue of registration. My appeal here is that that we want all these people to be registered. Everybody, all the 54 million Kenyans must be registered, so that when the government is allocating funds for primary health care fund for level 2 and level 3 and outpatient, so that through capitation, you can be able to access all those services. Every Kenyan has a right to access them without paying anything for level 2, level 3, and level 4 outpatient. For emergency, critical, and chronic illness, when you are involved in an accident, you have an emergency, you are involved in any emergency situation, the government, this house, has appropriated 2 billion to that fund, and it will continue appropriating more money, so that when you have a chronic illness, you have a critical illness, you have an emergency, you don't have to pay. You'll be admitted to any hospital, and that fund will be able to take care of you. And you remember the head of state said people have been selling their chambers to treat their patients. So we want to move away from that, so that you can be able to be, if you have a kidney disease, you can be able to be either dialyzed or you can even get transplant for the kidney. Both you and the donor will be taken care of, both pre-implant and post-implantation. You can also be taken care of. So this is the services that you'll be able to access without paying anything. But for S-Chief, you have to contribute. For those who have pay slips, we are contributing 2.75%. Then for others, they'll do what we call proxy mean testing. My colleague here has asked me, what are indigents? Indigents are those who are not able to pay. You have constituents who are not able to pay, whom the government was initially allocating money through this house to pay for them. But now you have those indigents who are supposed to access services. You've asked about you have elderly people within your communities. You have sick people who are within your communities whom needs to be registered. We are appealing to you that at your constituency offices, we will send officers. The list is attached here. Under the Digital Health Agency and the Social Health Authority, their officers, we've given their contacts, given their names. You can get in touch with them. They come and assist you to have those people registered, and they'll carry out the proximity testing so that the indigents, the very poor of the community, can be identified and can be put into the program where the government can pay for them through this house, appropriating funds to the indigents, and they can be supported so that they can access all the health services without having any challenges, without them paying for it, but the government will be able to pay for it. So it is upon you now as honorable members to assist,
Conclude,
to have
Honorable
these people,
Chair.
to have everybody registered, and the issue about challenges of people being registered, we are sending officers there to assist. And if you are in NHIF, you should not worry because you must be transitioned to Social Health Authority without any challenges. And you should not be able to miss any service that you are in NHIF, now you are in Social Health Authority. You can still access services. Thank you, Honorable Speaker.
Yeah, honorable members, I think this was a statement which was sought, and we have given it a sufficient ventilation. Wednesday morning is for private members' motions.